Well, hello, everybody, and I want to thank you as well for joining us tonight, where I hope to share with you a field that I'm very passionate about, this world of regenerative medicine. Um, and we've been practicing this for some 5 or 6 years now, specifically platelets and stem cells. And we added this. We added this tool to our tool chest at that time, and it's really proven to be a very powerful healing tool, a very powerful means to get people to moving again, and equally as powerful alternative to surgery. So before we jump in, a little bit about myself. I've been a practicing physiatrist here in Grass Valley for over 18 years now. And I co-manage a practice with my partner, Dr. Mike Jensen, and am board certified in both sports medicine as well as physiatry. I've been a Regenix affiliate for over 5 years now, 6 years really. But to be fair, I've been practicing some form of regenerative medicine since residency, so close to 20 years now. Another important aspect of myself is I've enjoyed being involved in doing and having a very active lifestyle ever since I was a child. And I enjoy various recreational pursuits that bring me joy and help me explore the beauty in our immediate surroundings, namely the Sierra Nevada mountains, but elsewhere as well. So it's been a very important part of my life outside the office. But to be fair, this active lifestyle has also been a very powerful teacher for me. Actually, one of my most powerful teachers through all my training. It's taught me a lot about health and how to optimize health. And it's also taught me a lot about the disease state, namely the orthopedic injuries. And it's also taught me a lot about what it takes to go from a disease state back to the state of health. So again, it's been really one of my most powerful teachers. And it's also been instrumental, this active lifestyle, in terms of defining what truly is our core treatment philosophy here at the clinic. And that is we really have a passion here to get people back to the things they enjoy, the activities that they love. And really feel that the most powerful measurement of this is, or I should say, this really is probably one of the most powerful measurements of restoration of health, and that is returning to activity and function. So why are you here? Well, the most common denominator is most of you are having some pain of some sort in various aspects of your body. This has led to downtime and frustration and all sorts of feelings. You may have evolved in your treatment protocol or injury adventure and had seen a surgeon, but are really trying to avoid surgery, or you've been told that you're not a surgical candidate. You're looking for options, don't want to rely on meds anymore, and again, really want to get back to the activities that you love. So in today's discussion, we'll touch upon a few categories. We'll start real briefly talking about what is available currently or traditionally, I should say, in orthopedic care. And then we'll introduce this world of regenerative medicine, as well as another field of medicine called interventional orthopedics, which has really been instrumental in the success of regenerative medicine. And then I'll tell you a little bit more about Regenix and how Regenix is very different than any other clinic offering regenerative medicine treatments out there. And then we'll touch upon some misrepresentations in the stem cell world and try and clarify some of those misrepresentations. And then we'll finish up with question and answering, as Dana alluded to. So current options in orthopedic care, well, it's rather simplistic, and there's really only 3 categories. The first is pharma. The second is conservative treatment or non-surgical treatment. And then finally, if all else fails, oftentimes we are referred to one of our surgical colleagues. So many of us, I should say, start the healing routine, the healing adventure, if you will, through pharma. And that may start with just self-medicating with over-the-counter medications like Tylenol and ibuprofen. And if that proves to be ineffective, then oftentimes we'll go see our primary care physician and get prescribed an opiate or more powerful anti-inflammatory, or even in some cases, steroids. But what we have found, and certainly what has proven to be the truth of that matter, is that they are temporary band-aids at best. And of course, all have various side effects of one serious factor or another. And then there is the world of non-surgical treatment, which could involve any of the following, or a combination of the following, including physical therapy, chiropractic treatment, acupuncture, massage therapy, or even bracing. Now, to be fair, I am a rehab specialist, and so I strongly believe in the rehab model. And I always tell folks who come in to see me for the first time that there are really two goals to treatment. The first and foremost is to try and get the pain addressed. And then that is followed, once the pain has been addressed, followed by training that individual in various strengthening exercises and range of motion exercises, which ultimately can restore mechanical deficits that oftentimes lead to the injury or the issue in the first place. And so, that is our approach to complete care. And, physical therapy really can address both of those areas. And I find really can address probably 80 to 90% of those issues out there. If we're having difficulty getting traction in terms of getting pain addressed, then sometimes we resort to injections. Typically, it starts with a steroid injection. And in some other cases, in the case of arthritis for knees specifically, there's another medication that we can use called hyaluronic acid injections. But steroids have their own side effects and own risk factors. And these two oftentimes prove to be temporary relief at best. And so classically, that usually, if all else fails, or if all the previous fails, then oftentimes we're sent to go see a surgeon to consider surgical care, which typically consists of either replacing the joint, removing various tissue within the joint, or repairing that tissue. And this has really been classically, at least if not the standard of care, the classical care. But we have done a lot of research over the last 5 to 10 years. In fact, there's been more research on the outcomes of surgery in the 5 to 10 years than there has been in the previous 60 years combined. And this research is telling us that there's some problems with the surgical model. Sometimes it proves to be completely ineffective or inappropriate for that matter. Obviously, there are risks. Some folks have allergies to the metals that are used in surgery. And obviously, there's risk with anesthesia and the surgical process itself. And even if it is an effective procedure, it doesn't always work for everybody. And then, of course, once done, it can't be undone. So again, a lot of research has been done over the surgical outcomes recently. And the research is showing us a different picture in regards to surgery, and it really has proven that up to 53% of surgeries are ineffective. So that leaves us with what's next? What other options are there out there? And that's what we'll spend most of the rest tonight talking about, is this world of regenerative medicine. And again, upon adding this treatment tool to our box, have found it to be a very powerful means to avoid surgery. So what is regenerative medicine? At its most basic, it's using our own cells, namely platelets and stem cells, to either help repair injured tissue, such as tendons, ligaments, other soft tissues, namely meniscus and labrums, even nerves and discs. Or in the case of stem cells, can be extremely helpful at alleviating the symptoms from more degenerative conditions such as arthritis, but in addition, even help restore some of that cartilage loss. What can be treated? Well, in our clinic, we treat all joints, knees, shoulders, hips, spine, elbows, ankles, and hands. And each of these various joints, we treat various aspects of the joint, whether it be arthritis, the soft tissues such as tendons or ligament tears, or again, even meniscal or labral issues. What is interventional orthopedics? Well, at its essence, interventional orthopedics is use of technology to help in the guiding of these cells very specifically into the area of injury. And it really has proven to be what really makes regenerative medicine successful, because without appropriate guidance, without being able to place the cells in the area of need, regenerative medicine is not effective, or at least less effective. So in essence, it really does ensure the success of regenerative medicine. The correlate to interventional orthopedics is a field of interventional cardiology. Now, many of you may recall at one time, most heart procedures were done by a cardiothoracic surgeon, who, if they felt you're appropriate for surgery, would access the heart by going through the chest. But a very savvy cardiologist discovered that by using the help of X-ray guidance, he could pass a catheter from a vessel in the leg and guide this all the way up to the heart, where they're able to do treatment, such as place a stent or remove tissue. And it's because it has proven to be a much simpler and less invasive, and ultimately a less expensive means to address these cardiac issues, has over the course of time replaced cardiac thoracic surgery by up to the tune of 70 to 80%. So interventional orthopedics really is, many of the leading minds in this field feel that the same outcome will be true with interventional orthopedics. Again, it's simpler, much less invasive, and ultimately much less expensive than surgical procedures. And so these same folks believe that within the next 5 to 10 years, 70 to 80% of surgery will be replaced by this treatment. Again, it's needle-based and image-guided. Now, jumping into this a little further, anybody who's involved with orthopedic care has various tools at their disposal, and that ranges from simple injections to surgery. And 95% of all physicians are doing simple injections. And what that entails is just simply usually injecting some sort of cortisone solution in a joint. They may not have a definitive diagnosis, and that individual may not be trying to treat a specific tissue. They're just trying to get it into the area in hopes that that medication will find its way to the injury and provide some relief. Now, many clinics have been picking up on new technology, namely ultrasound imaging, and they're using this to, again, maybe get a little closer to that tissue, but they're still not really defining what's causing the pain, and they're still not using that technology to get it spot on to the injured tissue. Now, out of all these physicians, 1% of us can be defined as interventional orthopedics. And the role of an interventional orthopedist is first and foremost to diagnose. And to do that, the first thing that's important to understand is there's various tissues in a joint. In this case, we're looking at a hip joint. And as you can see, there's ligaments, tendons, labrums, the joint cavity itself, the bone. Any or a number of these tissues could be the culprit in terms of what's causing the individual's issues. So first and foremost, one needs to identify which specific tissues are causing the problem in the first place. And then, of course, using the imaging guidance to help guide the cells right to that tissue. And the same holds true for the knee joint. There's various tissues that could be injured or causing symptoms. And again, that needs to be identified and then targeted very specifically with the therapy. And finally, likewise, the shoulder, all joints really. What do we inject? Well, we have 3 different products at our disposal here in the clinic. The first is concentrated platelets or platelet-rich plasma, which many of you are familiar with. Platelet lysate, which is a product that comes from platelets, and then finally stem cells. So platelet-rich plasma is a cell that we get from blood. And it starts with just a simple blood draw. Once the blood's drawn, the blood goes to our lab where it's processed into a very concentrated platelet solution. And within that platelet, there are various growth factors and cytokines that are really the powerful instigators of getting the healing process up and going again. And again, once injected into the injured tissue, are powerful at getting this healing up and going again. And we use platelets to treat anywhere from mild to moderate arthritis, as well as the vast majority of tendon and ligament issues. Platelet lysate is taking that same platelet molecule and lysing the membrane of that molecule. And by doing that, we can have in our availability immediate release of these same cytokines. And namely, there's a specific cytokine called A2M, which is very powerful at mopping up inflammation. And whereas platelets by themselves can be a little pro-inflammatory, this will avoid that pro-inflammatory response. And therefore, we're finding this very effective at treating primarily nerve issues, such as compressed nerves from the spine or compressed nerves, say, in the wrist, such as carpal tunnel syndrome. So again, the platelets have growth factors and cytokines that can be very helpful at getting the healing process up and going again. And then there are stem cells. Now, stem cells are probably our most powerful healing cell, regenerative cell. And in essence, stem cells basically act like a general contractor or a conductor of an orchestra, if you will, in the sense that they signal out to all these various players, which is the players in the healing field, which is very complex and diverse, and gets them to the side of healing and coordinates them to work synergistically to get that healing process up and going in a very powerful fashion. We collect or aspirate stem cells from bone marrow, which we get from aspiration procedure from the back of the hip. And once aspirated, it is sent to the lab for processing, where we can get very concentrated stem cells, as well as platelets from bone marrow. And again, a very powerful tool to repair tissue. We use this for more moderate to severe arthritis, as well as for treating more severe tendon and ligament tears, and is used solely for all of our ACL treatment as well. So the breakdown of our procedures comes down to anywhere from 75 to 80% of what we do is platelet, and 20 to 25% is stem cell. The platelet, a little bit simpler of a procedure and therefore less expensive. Stem cell, a little bit more involved. And again, it's important. I feel this is an important slide because not everybody who comes to us needs stem cells. More times than not, as you can see, we're able to address these issues with platelets. So what is Regenix? Well, in essence, Regenix is one of the pioneers of both interventional orthopedics as well as regenerative medicine. And they've been doing this longer than anybody else and have really been responsible for developing the lab protocols, the techniques that are used in interventional orthopedics to make this what it is today. And again, it is a very powerful alternative to surgery. And to be fair, when I became interested in adding platelets and stem cells to my practice, I vetted a lot of companies. And I chose Regenix in large part because of their devotion to the research. I've seen many orthopedic procedures come and go in my career. And oftentimes, it may have been a well thought out procedure, but it wasn't researched, and the people who have benefited the most weren't identified. And that's important because ultimately what happened to these procedures is too many people were getting these procedures who weren't appropriate for it. So, the research is what vets that out. So again, their commitment to research is really why I chose Regenix to become an affiliate with. So how is Regenix different than all these other clinics offering this treatment out there? Well, they're different in a number of ways. Experience, which we touched upon already, their devotion to research, both in clinical and the lab research, as well as the research in regards to perfecting their platform. Anybody who gets a Regenix procedure is using guidance to help deliver that treatment. Data registry is something we'll touch upon in a moment here, and this is something that really feeds all of our research. Anybody who does or performs a Regenix procedure are specialists. You'll learn in a moment here that many other clinics, these procedures are offered by nurse practitioners, non-specialists. Cell source and harvesting source are also very important, and the way we do it at Regenix is very different than other clinics are doing, as is dosing. And again, I'll clarify each one and every of these subjects. So, as I mentioned, the Regenix folks are the pioneers of regenerative medicine, as well as interventional orthopedics. We've been doing this since 2005. So that experience really does translate into greater outcome. Our lab platform is far different than most other clinics. Most clinics have a bedside centrifuge. And what that means is once they've collected either the blood or the bone marrow, they put it in a centrifuge, and 5 minutes later, out comes the product, and it's the exact same for everybody. With our platform, we have a full-on laboratory. Instead of 5 minutes, we'll spend an hour and a half on the processing of the blood to platelets, and as much as 3 to 4 hours on the processing of the bone marrow to stem cells. So, again, this is true lab processing as opposed to just sticking it in a centrifuge and calling it good. And again, we have found this over and over and over again, that the reason why we go through this extensive lab process is ultimately it gives us a much greater outcome. Cell source is important, and this applies namely to stem cell. We get stem cells strictly from bone marrow, and we do so because this is the only legal FDA source, the only legal source that the FDA has certified as a valid stem cell source. There are other means, but again, the FDA has not certified these other means, and therefore they're illegal. In addition, the bone marrow has proven to be, the most researched and really the most powerful source of stem cells. And again, ultimately that results in greater outcome. Harvesting, we've developed and perfected techniques to help optimize the number of stem cells we can get from the harvesting process. And again, we have discovered that the number of stem cells is important. The more we can get, the more likely somebody's going to respond with the best outcome. In order to verify, how many stem cells we have specific machines that basically measure the number of stem cells and platelets that we have. And this way, we know what exactly we're dosing. A number of patients come in hoping to get a couple of joints treated with stem cells. And we have found that to get the best outcome, we need somewhere in the neighborhood of 400 million cells per joint. And if one's not measuring the number of stem cells they have after the processing part, then they may underdose a treatment. If they're only getting 400 million cells and they're treating two joints, then that individual's not going to do as well. So again, we know exactly what we're dosing. And again, that does optimize outcome. I've touched on this part quite a bit earlier. Again, image guidance is really critical in terms of guaranteeing or at least optimizing the success of this treatment. Without this, I would say most of the time you're going to fail. Sometimes you get lucky, but again, outcome is much, much, much greater with appropriate guidance. Now, our data registry, what this is anybody who comes and gets a procedure from Regenexx. We invite that person, that individual, to become a part of our registry. And what that means is that individual within the first year is sent 3 or 4 different questionnaires that are measuring response to treatment. And then after the first year, that may go down to once or twice a year, but we're tracking all of our patients. And currently we have the results of over 20,000 patients rather. And this is really what feeds, as I mentioned earlier, our research. So Regenexx has published over 44% of the world's literature. And again, most of this is fed by our registry. So again, our devotion to research is critical. Another reason why research is so important is understanding that regenerative medicine is still a very young field. We're still learning a lot, and we still have a lot to learn. So research really feeds tweaking the model of both the clinical procedure itself as well as the lab model. So again, these studies, these publications are really important in terms of, progressing the field and again, getting the best treatment possible for the individual. So that applies to both the clinic as well as the lab research. Again, what we're doing even 5 years ago is much different than what we're doing now. Again, we've strive to continue to improve, and we'll continue to do so. And again, what will be available in 5 years will probably be better than what's available now. Another thing that's important to understand is Regenexx affiliates are strictly orthopedic specialists. And what that means is orthopedics is our world. This is what we have a passion for. This is all we do. We're kind of obsessed in this field. The fact of the matter is that a lot of other clinics out there, you're not only not seeing a physician, but oftentimes the nurse practitioner or the PA will be doing the procedure. Or if you do see a physician, again, maybe a family medicine practitioner, or sometimes a doctor who has experience in a different field of medicine. So we believe that experience, again, is very important. So a typical procedure visit flow is somebody is coming in and they're being recommended to undergo PRP procedures. That starts with an initial 1-hour examination where we do a complete history, a complete exam. Oftentimes we'll ultrasound the individual and decipher whether or not that individual is a candidate for this treatment, as well as provide a prognosis of what they can expect from the treatment. And if they wish to pursue, move forward, then the procedure itself starts with a blood draw. And it's a fair blood draw. I mean, it's about the size of a blood donation, if you will. And we need that type of volume in order to get the concentration that we need to optimize response. So once drawn, again, it takes about an hour, a little over an hour, hour and a half to process. And that individual is brought back a couple hours, 2 to 3 hours after the draw, in which part they're re-injected, get the treatment. Oftentimes we'll recommend physical therapy if we feel that there are some mechanical issues that need to be addressed. And then we schedule that individual to see him back in a couple months to assess response. Now, as I mentioned, the stem cell, a little bit more involved. Again, that starts with initial evaluation. And then if they're deemed to be a candidate and we're moving forward, the stem cell is a 3-day procedure, usually a Monday, Wednesday, Friday scheduling of the same week. Day one starts with injecting an irritant into the tissue. And, as the parentheses state there, it tills the soil or gets the tissue ready for the stem cell that we do 2 days later. Day two on the Wednesday is the stem cell day, and that starts with an aspiration procedure. Once aspirated, again, it takes about 3 or 4 hours to process the bone marrow into a concentrated stem cell, as well as platelets. And therefore, the aspiration's done first thing in the morning, and then that individual is brought back in the afternoon for the re-injection. And that's followed 2 days later by adding more platelets into the tissue. And we add quite a bit of platelets with the stem cell because platelets have all the growth factors and such that the stem cell needs to optimize that healing response. And again, that's oftentimes followed by working with physical therapy to address mechanical needs and to work on stabilization. And then we again see the patient 2 months after the procedure. So one of the biggest hypes that have been very predominant over the last, I'll say, 5 or 6 years is this world of amniotic, placental, or cord, quote unquote, stem cell injections. This has been marketed very aggressively and misrepresented significantly. They market this as a stem cell procedure, but there's been over a dozen reputable universities, including Ivy League universities, in addition to our Regenix lab, who have proven that this particular product has no live stem cells. It has a lot of dead stem cells in it and a lot of other dead tissue. So to call it a stem cell is inaccurate, inappropriate, and immoral. And to the extent that the FDA has issued that anybody who is calling this a stem cell procedure, this is illegal. They chose not to regulate this because there wasn't that many players out there involved with this marketing scheme. But over the years, it's grown exponentially. And starting this year, January of this year, the FDA has cracked down on a lot of these clinics, shutting them down, and even in some cases, sending them to court and they're spending jail time. So, I mean, to be fair, amniotic tissue, there is regenerative potential. Amniotic tissue does have growth factors that can help with the healing process. But the fact of the matter is that it's only a fraction of the growth factors that are available in even platelet injections, let alone stem cell procedures. So we do use amniotics on occasion more as a scaffolding. So if a tissue is damaged to the extent that there's nothing to grow cells on, we'll use this as a scaffolding so that they can hold the cells in order to regenerate and grow cells. But that's about the extent of it. Many of these procedures are done in chiropractic offices, and the vast majority of time, no guidance is used. Again, a non-specialist is oftentimes performing the treatment. Again, these are dead cell products. The costs are oftentimes much, much higher than platelet injections, and I've even seen them higher than our stem cell procedures. Part of their marketing, part of their aggressive marketing is they sell people this line that you're just too old for your stem cells to be of use. Our research has proven that that's not true. We have found in our research that older patients do just as well as younger patients. In fact, I've worked on people as old as 97 who've still done very well with these procedures. So many of you are in the process of researching this exciting field. As you go through your research, I would just invite you to look out for certain red flags. Many clinics are offering heavy discounting or heavy emphasis on financing. That's probably a red flag. They also tell you that they'll cure anything. They're not selective in who they're recommending treatment for, and they feel like, and they tell you they can cure just about anything without skepticism, then that's probably going to be a red flag. Yeah, I mean, not everyone is a candidate for this type of treatment. And again, amniotic, calling it stem cell is fraud. Likewise, cord blood. There is this world of fat too, and there's a lot of good research showing that fat is effective. But at this point, it's still illegal. The FDA has not certified this. Now, furthering your research, I would invite you all to write down this. This is a website called stemcellreview.com. And it really has proven to be a very neutral and I would say reliable source of research. And they grade various aspects of each and every clinic. And it might give you a better idea of just, who to trust and who not to trust. So in summary, through this model of regenerative medicine combined with interventional orthopedics, we have discovered in our clinic that it is a very powerful means to restore healing and a very, very powerful alternative to surgery. Again, the combination of the two has proven to be a very powerful tool. Regenix, again, a pioneer in the field of not only regenerative medicine, but interventional orthopedics, as well as the ongoing pioneer of the research involving both fields, continuing to push the envelope and continuing to learn more about this very exciting field. And then finally, be cautious of the magic stem cell approach. Now, I'll end with just leaving this slide on the screen. If after tonight or, after you do some more of your research, you want to find out if you might be a candidate for this procedure, you can either contact us at the phone number listed there or through the website there. So at this point, we'll turn it over to questioning. Again, I want to thank everybody for coming out, and I'm happy to go forward with the question and answering process. So again, as Dana was mentioning, just raise your hand and I will look up on the screen and then just click on the individual. So it looks like our first question is from Ivan. Can you hear me, Ivan? Try that one more time.
Can you hear me?
There you are. Yes. How are you, Ivan?
Oh, pretty good, pretty good. Thank you, doctor, to take the opportunity to answer my question. I'm 63 years old. I'm being very active all my life working out. I just had a MRI done, and I'd like to know how successful is Regenix with a rotated calf, and the MRI results was that I have a full thickness tear of the anterior subprepitus fiber that is measured 1 centimeter.
Okay. Well, so what it sounds like they're describing is a complete tear of part of that tendon, not the complete tendon. Is there any verbiage defining retraction or muscle atrophy or anything like that?
No, they don't describe in the report. They're only saying that it's probably focal full thickness tear of the anterior, and you measure 1 centimeter. However, doctor, my motion is pretty good, and that's when I was surprised when I read the report. I can raise my hand without, raise it, and the only pain that I have is when I reach out in the back, a little bit, not that much. Okay. So my question to you is that MRI is a defined measure to see the full tear? I don't know if it's retracted or not retracted compared with the ultrasound.
Yeah. Well, I actually find the ultrasound is even better at identifying what tissue, if any, is still available. And again, it sounds like they're describing just the anterior or the front portion of the tendon, in which case that tells me you still have plenty of tissue available, and that's important. As long as there's tissue available, we, oftentimes we'll treat that with a simple platelet procedure, and that has proven more than powerful enough to restore and heal that tendon, even with a partial tear.
And then my second question, if you don't mind, is
Sure.
How many cases you've been done with respect to rotated cuff, and how successful is Regenex? And how long you see the result of all these patients that you deal with the rotated cuff injury?
Yeah, well, so these tendon injuries, particularly rotator cuff injuries, are kind of our bread and butter. We do this a lot. And, I myself have gone through the procedure for my own, rotator cuff tears where, I had 3/4 thickness tears to 2 of my rotator cuffs that, that I had injected with platelets. And after going through a very aggressive, rehab routine, my rotator cuff is healed 100% at this point. So, our success is very good. The healing, an important part to add to any type of regenerative procedure is that it is a process. Healing is a process. It's not going to address it overnight. But oftentimes what we see is, after 2 months, most folks are in the neighborhood of, experiencing 30 to 50% improvement. And then, at 4 months, that goes up to 60 to 80%. So, it kind of follows that type of path. So, again, it takes some time. And I kind of alluded to this earlier, but, these cells are very powerful healing tools. But I always like to explain that they're not the magic pixie dust. And it is important to understand that the rehab process is still very, very important, because if we don't address the mechanical deficits that contributed to the tear or the injury in the first place, then it simply can become re-injured. But if we can address these mechanical deficits with the right rehab model, then this, in combination with the procedures, in this case, a rotator cuff tear, is very successful at addressing it completely, healing it.
Thank you, doctor. I'm trying to avoid any type of surgery, especially with, my pain is not as severe in certain motion of, I can, like I explained to you, I can move around up and down. The only a little bit pain that I have when I'm reaching out in the back, and it's not severe. In the last 2-3 months, it has been improved a little bit. So thank you for your thank you for your answer.
My pleasure. Thanks for joining us tonight. All right, bye-bye. Okay, next question. Shelly, can you hear me?
Yeah, I can hear you.
Hi, how are you?
I'm good.
Good.
So I have a question. You talked about that you need to have a certain concentration of the stem cells in order to be able to you have a kind of a threshold, where you have an idea of how much you need to inject for optimal outcome. Is it pretty common that almost everybody who gets the harvesting has sufficient stem cells in that procedure? Does that vary? I don't know.
Yeah, no, it's been very rare that we don't have enough to treat 2 joints.
Okay.
We strive to get at least 400 million cells per joint, because we have found in our research that that tends to be the baseline number that will optimize success. Obviously, the more we can get, the better. The vast majority of the times, I would say 90-95% of the time, that's not been a problem.
Okay. And exactly where do those come from?
The stem cell?
Yeah.
Well, so we're aspirating bone marrow from the back of the hip.
So the back of the hip is like where? Exactly.
Well, if you feel on your backside, right around the belt line, you'll feel that bone, which is the top of your hip.
The flat part?
Yeah. And if you go
Okay.
on the inside of that bone, more towards the spine, we usually take it from what's called the iliac crest, or just below the crest. And that we choose that spot simply because it's one of the biggest reservoirs for bone marrow and stem cells that we have. And we have found that, we can get the most and the most viable stem cells from that area.
Okay. One final question.
Yeah.
You talked about the rehab and post visits. How often do those all have to be in-person visits? Or do you refer out for physical therapy?
Oh, we refer out all the time.
Okay.
Yeah. And no, it's not here at our clinic. I mean, if you're in our area, we would love to have you, but no, I mean, a lot of people are coming from Sacramento or Nevada or Redding, in which case, there's excellent therapists all over the place. So it's just a matter of finding that therapist, and we know one, and just do the research of finding one, and we'll get
what does that physical therapy entail as far as time commitment and cost?
Well, so I mean, most therapy is covered on your insurance, and to get an adequate rehab program, that individual may go once to twice a week initially, and that may taper off to once every other week type of thing. Oftentimes 8 sessions, it's all that's required. And most of that is just training that individual in the right program, making sure they're doing that program correctly. And once they got a good understanding and a good feel for that program, then it's all about the work you do at home. I always like to discuss how important the consistency of the program is. I always invite people to, if you can commit to that program at least 4 or 5 times a week, it's that consistency that's going to make a difference in time. And with that type of consistency, again, it really can help address these mechanical deficits that contribute to.
And in general, what length of time do people spend in physical therapy before they're able to? I'm not saying not do the same, continue with some of the same program, but how long does the physical therapy post procedure typically last?
So the actual therapy part, again, most of the time it just takes 7 or 8 sessions, and that might be over the course of a month or 2. In some cases, a lot of folks have had therapy beforehand, so they have a good understanding of stuff that they can do already. And in that case, it would just be a matter of maybe returning to see if we can progress that program, and that may take 3 or 4 sessions. So it all kind of depends on the individual.
Okay, thank you.
You're welcome. Well, thanks for joining us, and we'll talk soon. Okay. Let's see. I have another question, and pardon me if I'm mangling your name, but is it Jing? Hello, can you hear me? Jing, can you hear me? Let's see, I'm having a hard time getting Jing on the line. If you can't hear me, it may be a connection problem, in which case you might just, let's try that one more time. You might just try and text your question, and Dana can read that.
I did.
Oh,
I did.
You?
Can you hear me now?
Yes. Hi.
Oh,
how are you?
yeah. Hi, how are you? Thank you, Dr. Lichner. Yeah.
Of course. Well, did you have a question?
Questions? Yes.
Yeah.
And recently, I just got work injury. I hurt my back. So my back, like MRI, I told you, is a disc causing bulging. But it didn't say it's any like a ligament or something tear. It didn't say that. But I'm thinking when it bulging, it must be something weak at that, that part that's causing the, the lumbar. slips. So I'm thinking it's this therapy is good to like help that, like put in the glue or seal the weak part area. So in that way, when you're bending, it won't slip out.
Oh, okay.
Because I heard you mention ligament, all this like a tendon, but I'm not sure if this one also is the case.
I'm sorry, I didn't catch that last part of it.
For the disc bulging.
Yeah.
Well, it's a weak part that come out, right?
Yeah. Well, disc bulging we all have to some degree. So disc bulging by itself doesn't necessarily identify that's where your pain's coming from. So I mean, disc bulges are kind of wrinkles and gray hair. It's just they're inevitable. There's nothing we can do about that. So I mean, first and foremost, we got to identify what is causing your pain. So I mean, if it turns out to be a disc, then yes, platelets can be very helpful at healing disc tears, which can cause significant pain. But there's other issues too in the spine, joints and ligaments and even nerves that could be contributing as well. So finding of a disc bulge doesn't necessarily identify that's what's causing your pain.
But in case like this kind of problem, because the bulging means if the vertebra, like lumbar 4, lumbar 5, they slip each other. So it's anyway, there's something like inject something, like block that one, like what they call like a seal or glue, between the one. Yeah.
Yeah, I mean, there is another procedure where they inject a substance called fibrin, which is kind of like a glue. But platelets act like a glue as well. So platelets can help seal tears. They can also help, with the use of growth factors and such, heal the tear and even restore some of the, in some cases, the height of the disc.
I see.
And again, if that proves to be your pain source, yeah, that can be done, and it's proven to be very effective. That's actually one of the most exciting areas of regenerative medicine over the last year or two, that we're getting MRI evidence of how just simple platelets can really help with discs. How
do they identify the pain source? That's my question then.
Well, so the vast majority of time we can identify that just through a good history and physical exam. And if there's still question after that point, then sometimes we do diagnostic tests. So for discs, there are specific diagnostic tests that can be done with injections, or if we're thinking it might be something else causing the pain, we can do diagnostic blocks to other areas of the spine too, which are very effective at identifying what's causing the pain.
I see. Well, for me, like a work-come case. So you or your folks do the work-come case too, accept the workers' comp case?
Yeah, well, workers' comp gets a little complicated simply because if your workers' comp folks don't authorize it, then it just legally it can't be done if it's to be covered or under workers' comp. And I don't know that workers' comp is. I mean, I've heard of a rare few individuals who have had some treatment done under workers' comp using platelets and such, but that's hardly the norm these days. So it gets a little more complicated with workers' comp, like everything with workers' comp.
Yeah, for this part I'll ask, but just my question. You just mentioned the platelet, but it's not like using stem cell technique to do this the problem, to fix the problem.
Well, so there have been cases where stem cell is more appropriate, but again, 99% of the time, platelets are more than powerful enough to address most spine conditions.
For the spine issues. Thank you, doctor. Thank you, Dr. Richard. Yeah, I learned something. Because I'm just thinking the new technique, like just like a sew something like the best, because I've been seeing like lots of people like went through the surgery, but not as perfect as right? So I'm thinking this new thing may be better, little bit in invasive, just the needles of inside, and then
Right.
if it can help heal, that's better than open up to get the scar there, and then because scars are more limited your movement, but the injection inside is better.
Absolutely.
Yeah.
And it's just a matter of time. I mean, this procedure will replace fusion, because that's the only
Right.
tool that the surgeon has, is to fuse that level, and that's a terrible outcome.
Right. Because I work in the hospital. That's why I said, well, I look at the new regenist. I said, well, let me just attend the same, to ask doctor, Yeah. Thank you so much. Yeah.
Well, thank you for your question.
You're welcome.
All right.
Yeah,
Well,
maybe later on more advanced, do more research you can help, because lots of people have that pain, that problem.
Absolutely. One of the biggest, no question about it. Again, thanks for your question, and take care. Bye-bye.
Okay, thank you. Bye.
Okay, and another question. JP, can you hear me?
Yes, can you hear me?
Yes, hi, how are you?
Good. I had a back injury that resulted in an extruded L4, and which caused drop foot in my right foot. Is Regenix, could that help drop foot?
It can. Yeah, I mean, what we do is we use, if there's still extrusion, if it's still causing impact on the nerve, we'll use platelets to help, heal the disc extrusion. But we'll also place some platelet lysate around the nerve itself to help regenerate the nerve. And that can help with drop foot.
Okay. And also I've got a torn meniscus in my left knee. So I'm sure that's one of your procedures.
Absolutely. I mean, meniscus are kind of like rotator cuff tendons. It's kind of our bread. Okay. We do a lot of them.
Okay. All right. Thank you.
You're welcome. Okay. Any other questions out there? Looks like a number of folks are probably heading off to dinner. So, as I say, if there are further questions that happen to arise after our webinar here tonight, don't hesitate to contact us at the contact numbers that you see on the screen there. And we can certainly attempt to address your questions, and if any of you want to come see if you might be a candidate for this procedure, give us a call, and we can set you up and see you here in the clinic. We even do telehealth telephone visits as well on occasion. We prefer in-house just so we can get our hands on you, but we can certainly go that route too.
Excuse me, Joel.
Yeah.
Jing has another question, which is, will platelet injection cause blood clot?
Will platelet injection cause blood clot? I mean, one of the first things that happens with platelets is, particularly when we're addressing a tear, such as a meniscal tear, for example, the tear itself has two edges, right? So the platelets are sticky, and they help, it does clot and help those tissues bind together. But it's not the type of blood clot that you may be familiar with, where one gets a clot in a vessel and causes, heart issues, that type of thing. So it's a different type of clot. It's a healing clot, not something that can cause a heart attack or a stroke. Hope that addresses your question. Looks like we have another question here from Becky. Can you hear me, Becky?
Yes, can you hear me?
Yes, hi, how are you?
I'm doing well, thank you very much. I just wanted to say thank you. That was an extremely informative and well-organized presentations. I really appreciate it.
Well, thank you. Thanks for those comments.
All righty, that's it.
Oh, okay. Well, thank you. I appreciate the comments. And if any questions arise, don't hesitate to contact us. All
Will do.
right. Bye-bye. Let's see. Jing, Jing, do you have another question?
Yes. The last question, doctor.
Yeah.
How much does it cost in average? I mean, like, like a fixing like one for single one, like, the injection.
It depends. I mean, platelets, usually somewhere in the ballpark of 1,500 for, the draw, the lab processing, re-injection.
Mhm.
Stem cells, because they're a little bit more involved and they're a 3-day event. It can be in the neighborhood of 6,500 or more.
65,000. And the insurance will pay for-
6,500.
Yeah. Oh, 6,500. Yeah.
Yes.
Oh, 100, not 1,000. Not 65,000 and 6,500.
No, exactly.
Oh. So another one is a 1,500, not 15,000.
Correct.
I mean so will the insurance company, pay for part of it?
So they won't cover any of the procedure. They'll oftentimes cover the workup, if an MRI needed or physical therapy, but not the procedure itself. Oftentimes they'll cover the evaluation though.
Evaluation, but not the procedure. You just mentioned it's a procedure cost, right? 1,500 or 6,500 is for the procedure only, not mention any other costs, right?
Correct.
I see. Oh, even the work comp they won't cover. The work comp they won't cover.
Again, on rare occasion, I've not actually seen any individual heard of workers' comp, covering a procedure if they authorize it, but that can be process.
I see. Thank you.
Okay.
not 1,000, it's 100. Okay, so I'm okay with 100. Thank you, doctor.
You're so welcome. All right. Bye-bye. Okay. Another question from, is it Ricardo? Can you hear me? Let's see. Ricardo, can you hear me?
Yeah, I can hear you, but I don't know if you can hear me.
I can hear you now. Yes. Hi.
Okay. So I had two questions. One was just got answer the cost, because I don't think our plan of the insurance will cover this. So now I know it's around 6,500. And my second question is, to do the treatment, do we have to be there for like 4 or 5 days?
Well, so yes, it's 6,500 for the stem cell and 1,500 for the platelet. If you're doing platelets, it's just a day procedure. The stem cell procedure, if you're coming outside of our area, oftentimes what people will do is they'll come for the pre-injection on the Monday, go home, and then maybe come back Tuesday night. And if it's far enough away, maybe stay Tuesday, Wednesday, and Thursday, and then go home on Friday.
So, okay. So it is like a 4-day that we have to allow to take care of this. And that is if we are candidates for that. So.
Exactly. So
hopefully we are.
Yes. Yes. Yeah. And that's, the evaluation can really flesh that out as to, whether or not you're going to be a candidate, as well as what you can expect if you are a candidate.
Great. Thank you very much for answering my questions. And this is
you
great. We're excited about it.
Good. Well, thanks for joining us tonight. I appreciate it.
Thank you.
Bye. Okay. Well, so I'm not seeing any more hands. And I'll just reiterate that, if there are any other questions, or certainly if questions come about once we're done here over the next few days, don't hesitate to give us a call, and we can address those questions. So looks like that's the end of the hand. So at this point, we'll wrap it up. Again, I want to thank everybody for coming tonight. And please give us a call if we can provide some help. Okay. Well, good night, everybody. Take care. Bye-bye.